This is my apartment. I'm on my day off running errands. My name's Matt Brunke. I'm a veterinarian here in Maryland in the United States, and I am a specialist at DAC VSMR, which is a mouthful of letters. It stands for Diplomat of the American College of Veterinary Sports Medicine and Rehabilitation, which means that basically for the last, well, I just got boarded about 2 years ago. For the last 10 years, my entire aspect of practice is rehab and pain management and arthritis management. So I'm looking forward to being here today with Hannah.
Exactly. This is ace, and we're just so lucky. I can't tell you. We had your really good friend David Dykus at the beginning of the year, now you. So thank you guys. It's really, really helpful. I think what we're going to do is kind of crack straight on, because there's no way in the world we're going to cover everything that I want to cover in such a short space of time. Okay. But we decided that we were going to go straight for the throat. We're going to talk about nutrition and supplements and get that done and get it out of the way. So you've written a lot about this. I see you doing articles quite frequently. So I have every confidence you can just roll with it. Tell me what you know.
Yep, and I can cover the nuts and bolts of the basics. I'm very lucky that my sports med mentor is Dr. Joe Washlag, who's at Cornell, and he's double boarded in sports medicine and veterinary nutrition. So I got this hammered into me as my residency, whether I wanted it or not. So thanks, Joe. I always appreciate it. But no, nutrition is a huge component to veterinary medicine and to arthritis, because at least in the United States, okay, 2 out of 3 dogs and 2 out of 3 cats qualify as obese. Not overweight, obese. So on a BCS, on a body condition scale from 1 to 9, okay, where 1 is a skeleton and 9 is a watermelon, 5 is our ideal. Most dogs in the United States and cats qualify at 6s or 7s, which is 10 to 20 to 25% excessive body weight. Now, I'm not in my fun time, I run marathon, okay? So when I'm in racing season, I'm like 195 pounds. Right now I'm running 205. So, all right, we're going to go 10 pounds, Matt, you could probably drop it. You know, that doesn't seem so bad over my size frame. Yeah. But if you have a Chihuahua that weighs 10 extra pounds, that poor thing's a watermelon. It's a bowling ball. You can't get around, you know, and you think about...
We've got a problem like this in the UK as well, and I've just moved to Scotland, and I'm really sorry to all the Scottish people that follow us, but there is definitely a bigger proportion of overweight dogs up here. And I think once people stop realizing what normal looks like, then we're on a bit of a downhill slope. People don't question the watermelon.
Right, because we think it's normal and we use food as love sometimes. But the thing is, so let's talk a little bit about obesity, and then we'll cover some of the nutrition topics. But just as obesity, you know, it's not just gravity putting more weight on those arthritic joints. Literally, it's like trying to walk around with an extra 50-pound sack on your back, okay, for these arthritic elbows and bad knees and hip dysplasia cases. But it's the simple fact that fat is not an inert substance. So fat at a molecular level, at a microscopic level, actually secretes these little things called inflammatory mediators that actually make arthritis worse at a chemical level, okay? And there's been studies in dogs and in humans that the less fat that they carry, the less problematic and painful those arthritic joints are.
And
so it's a question of gravity.
It's not linear, it's kind of like exponential, isn't it?
It's huge. Yeah. It's huge. It absolutely is. So when I look at that, what I always want, you know, if we're looking at a dog or a cat, the simple thing is just to make a fist and rub your finger over your knuckles, okay? Yeah. This is what your dog or cat's rib cage should feel like. You should be able to find individually and press down. If you kind of have to squish in like a really soft pillow to find those ribs, there's too much weight there.
Yeah, so I do something similar. I say, like, when you're baking a cake and you're just touching the sponge to see if it's cooked or not, that's how heavy you press. You don't press in to find the rib. As you're touching your baked cake, you go, oh, there it is. It's just there.
Well, and that's the thing, is because, but why is there all this confusion and stuff? And I think that at least in the States, and I've seen it in Europe and stuff as well, you know, the back of the bag, right? Because what do? We buy dog food. We maybe get a recommendation from our veterinarian, maybe we don't. But we buy the back of the bag of dog food and we flip it over and it says, okay, for a 40-pound dog, feed, you know, a cup and a half a day. Okay? The thing is that the back of the bags of food are designed, and this is going to depend on country to country, but the back of the bag of food is designed for an animal that has their sexual organs.
Ooh, nice one.
Now, in the UK, much higher rates of intact males and intact females.
Yeah.
Okay, so maybe that's a component as to why, at least maybe in England, maybe not as many chubby dogs. But in the United States, we have such a prevalence of spaying and neutering. So the day that an animal is spayed or neutered, their caloric requirements drop by 25 to 33%.
Yeah. Yeah.
So think about it. When I used to do general practice, I used to spay and neuter dogs and cats, and I would say, you know, you're going to go home, here's your pain meds, everything went well, here's the cone of shame you have to wear, but by the way, we're going to save you money. And owners would be like, well, how? I'm like, go home today and cut your food by 25%, because their body doesn't need it. If they're not using calories to cycle ovaries and to make testosterone, to make sperm, they simply don't need the calories, and then they just put it on as blubber.
I'm going to add a fact to your fact. They did a study at the University of Liverpool of how accurate cup feeding was, and they took a load of people in the department, and they found that there was a disparity between minus 18% and 80% plus in the weight of that cup. So even though it was a cup, and everyone, oh, I just gave him a cup, there's a massive range to that kind of feeding technique.
There is, and the thing is you have to even ask, like, what cup? Like, I try to send home owners with a specific measuring cup, because I've had them, you know, it's a scoop, and what it was it was the 64-ounce tumbler, a souvenir cup from Disney World.
Yeah,
you know, that
well,
they
that's
were
like
feeding
me with beer. I just had a beer.
Well, but that works plenty well for us. But for the little dogs and stuff, you know, it's a tougher spot. And not all food is created equal. You know, some food, when I'm getting to quality and breakdown of nutrients, but just looking at that, some food is more calorically dense. So a cup of one brand may have twice as many calories as a cup of the other.
Yeah.
So we really have to sit down, and the veterinary teams, the veterinary nurses are such a great component to this, to helping get the right math out there, and start with a healthy area for arthritic patients, for any patient.
And I think it's a bit sad. It's a bit like my feelings about arthritis. It's a really neglected area of medicine, because I don't think people are hugely excited by it. It hasn't got the kudos. It isn't really super exciting. I think weight management is put into the category of this is a bit uninteresting for owner, and I think staff struggle with that kind of negative attitude, when actually it's foundational for so many disease processes and healthy animals.
Right. I mean, we know fat cats are more prone to diabetes. You know, there's all these other issues. And the thing is, like, I have fun. I can inject stem cells and platelet-rich plasma into arthritic joints. We can do all sorts of amazing things in surgery or in a rehab department where they're coming in, but I'll look at them and I'll go, you do realize you wouldn't have to spend all this money or have your insurance cover all these things if you could get 10 pounds off your dog.
Yeah.
Like,
Well, it's really
literally.
exciting, because I'm delving into your world. I'm 4 weeks into your world, so I'm doing stem cells and stuff as well. But exactly the same. You know, I sit there thinking, this is thousands of pounds that we're about to do, and you are hindering it having any good effect by not taking this part of the treatment plan seriously. But on that note, I know that we've now got coming on 20,000 followers, got 19,000 followers, and I challenge you guys to reassess your dog's weight, because I have this all the time when people go, no, my dog's fine. And I'm like, no. Go back, pretend it's not your dog, completely fresh eyes, stand back. So look from the side, look from above. But it's not your dog. Pretend it's not your dog and critique yourself, because a lot of our followers put photos up and say, my dog's at hydro, my dog's out in the park, and it's lovely to see it. But we see weight and we're like, come on.
Yep. And that's the thing, dogs and cats all come in different shapes and sizes. So there's not a universal way to look at a pug dog versus a German Shepherd dog or things like that. It's not a hard and fast set number. But we have to get into the ballpark because even people come in different shapes and sizes. And when we're not out to say that everybody has to look uniform in one way, but we want to be in a healthy weight range. And when we do that, we have a greater chance of having a longer, an increased quality and quantity of life for all of us.
So guys, take home from this is that we would like you to challenge yourself. And if you don't feel confident in challenging yourself, go to your vets, because I do not know of any vet in the UK, and I hope not in the US, that if you went in and said, I'd like to speak to a nurse and I'd like to have a weight check, the likelihood they're going to charge you for that is absolutely fractional. If they do, say Hannah was angry, because we shouldn't be charging for that service. If an owner comes forward and says, help me make sure my animal is at the correct weight, we should be there for them. So that's cool. And I'm going to give you my little analogy. Fat is like petrol on an inflammatory fire. There you go.
Yep, exactly.
So let's now skip from the whole weight. Let's go into the danger zone where we start talking supplements and bespoke, etc. Where are you with all that?
The thing that I always look at with supplements is a couple of things. Okay, we want to be as proactive as possible. So reaching for when the older arthritic dog comes into the vet clinic, or you take them in Friday afternoon right around this time, the supplement is not going to make them feel better in 2 or 3 days.
No.
There are good ways to help. They're called chondroprotectants, right? So protectors or cartilage, preemptive matter, right? We want to protect that cartilage. If we know that it's going to be a police dog or an agility dog that's going to be really pounding cartilage a lot, we want to do that. And of course, if they're going to be chubby, then we know gravity is going to put more of a weight on them. So when I look at that, I want to be proactive with them. I also realize that most of the studies that are out there look at all the different supplements. They take about 60 to 90 days to see clinical improvement.
Yeah.
Okay. So when we do this, it's it's first couple of days of August. We're not going to look for an improvement on that until November 1st.
Yes.
Okay? So we have to have time to build these things up in the body to help protect those joints. And sometimes people say, well, you have such severe arthritis, your hips are totally shot, we need a total hip replacement. And the owners go, well, then why am I still on the joint supplement? If there's no cartilage left in my hips, why am I on the joint supplement? I said, well, because your elbows, your knees, and everything else are working twice as hard. Where there is cartilage left, so we have to protect that. So when I look at that, I think that it's really important. The thing that comes down to it is you have to have reliable sources and know what's there. A joint supplement, a nutraceutical, is a purified or refined form of a component to healthy nutrition. So, there's avocado and soybean fatty acids, essentially, unsaponifiables, that are really helpful for arthritis. But we know that we can't feed our dogs avocados and soybeans. Right? It has to be that purified form. Everybody always asks, oh, can I just top dress my dog's food or stuff with turmeric? And it's not. It's curcumin extract that actually has the benefits. Because if this is turmeric, only 0.0001% of it actually has a component that we need. So you'd have to feed so much of it in order to get a result if it'll get absorbed. And if you thought your dog's toots smelled bad before, imagine trying to feed them full of turmeric all day long. And that's the thing. So it has to be a purified form. And the thing is, but since it's not a drug, there's no federal oversights for humans or in veterinary medicine. So you have to know the source, the company that's making it, where are they getting their materials from, what are their research and what they're getting out of it, and making sure you're looking for evidence and facts and not just claims. Right? Claims are it cures cancer. I've seen that on joint supplements. I'm like, that makes no sense. We have to be really proactive in these. And so getting a good recommendation from your veterinarian is really the key on those, because we want to find things that, if we're on a budget and you're spending 30, 40 pounds a month for your big, Labrador to take these joint supplements, what if it's a big waste? And here's the thing. So there was a study done about 20 years ago on the human side. that looked at 32 brands of a joint supplement, 32 brands of chondroitin. And what they did was they went to the store, they bought a bottle of it, they put it into a chemical analyzer, they ground it all up, and they just said, does it have at least 90% of what the label claims?
Mm.
Seems pretty reasonable, right? Human supplement. Anybody that's watching this live, anybody want to chime in? Maybe Hannah will look for the comments. Anybody want to guess out of the 32 brands had at least 90%? You can wait a second.
It's going to be too delayed. Just saying,
okay.
It's going to be scary.
All right, I was trying to see if anybody would catch it. It is 6. 6 out of the 32 brands had at least 90% in it.
Yeah.
And the thing was, this was a US study. Okay, they also plotted it by cost per day to a human. It would range from 20 cents a day to $5 a day. And everything above $3 and up per day had nothing in it. It was a sugar pill. Yeah. So spending more doesn't mean you're getting better quality.
No, we did. For anybody that follows our thread, go back a day, and I put one up from the BBC about CBD products, and it's just gone rife over here. It's gone rife, and they looked at some products, and there was one that was like £50 a pot, and there was no CBD in it.
And that's the thing, without any oversight, since it's not truly a drug, you could, when I teach veterinarians and stuff about this, I joke with them. I said, you could go to your basement and grind up some sawdust and put your smiling face on a label on the bottle and pay off your student loans with it. Yeah. Now, none of us would do that, but that's what is available out there, and it sells and it's popular, so people are going to try to get a piece of that market.
And we were talking at CAM in that we try and finance this. It's a nightmare. It costs a lot of money and time and energy to do this. And if we took out a supplement, that would just be a winner. That would be a winner because everybody trusts us because we look after them. We won't do it, guys. It's not happening. Never will that happen. But we know that you guys are vulnerable with regards to requiring this. You want to make your dog better. You want to do the best you can. You want to go to bed at night going, I am doing everything in my capability. And supplements fall very well into that category. They're purchasable, they're givable, it's a tangible input into your management plan. Whereas other things can be a lot harder, like therapeutic exercise, like moving from a house with loads of stairs, like changing your car from a high, booted car. These are harder. Buying a supplement's really quite easy. So it's one of the first things a lot of people do. So yeah, I'm glad that you said all that. So for people that want advice about supplement, what are your key take-home statements? Do you think you 10?
Sure, 10 absolutely. I mean, the thing that you always want to ask is where do they have proof of what they're actually making, right? Do they have analysis that shows what is in the bottle is actually what's supposed to be in the bottle and what they claim to have? How do you
find that though? That's something that I find really hard because I looked into the CBD products when they were just beginning to go right, and I kept looking for this data analysis sheet or this proof, independent laboratory proof, and
you have to ask the company. Yeah, you have to ask, since there's no oversight, you have to ask the company that makes it directly. So that's up to us as veterinarians. Okay, we have to be comfortable because with 1,000 products on the market, we have to be comfortable with maybe 2 or 3. And I'll be honest, with the thousands upon thousands that are out there, how many am I comfortable with? Yeah. 2. Okay. Yeah. There's and I look at that's what I always look at is I get comfortable with a couple because everybody's always going to come to something new to the market. But I've gone into and asked new companies, oh, let me see your research, and they'll hand me. I had one company who will remain nameless who handed me somebody else's research. And they said, oh, this was a chondroitin study, and it shows that it's absorbed. I said, yeah, well, that was a very specific chondroitin, and that was, proprietary to that company because I pulled up on my phone because I had the copy of the journal article it was from. So people will steal evidence. You have to be careful out there. You really have to ask for data, and you have to ask that the math is right. Because, I go into the pet store and I'm standing in line to check out at the queue. And, there's a little box of dog treats that says with glucosamine on it. I'm like, cool, this could help my dog. I flip it over and I do the math. My dog, who's 50 pounds, would have to eat 5 boxes of treats per day at $20 a box in order to get the amount of glucosamine out of it. So just because they scant it in there, and unfortunately some of the pet food companies will do this too, and your pet food bag will say, with glucosamine. Mm-hmm. The thing is, you have to make sure the math is done right. Because just because they can sprinkle it on doesn't mean it's there in quantity enough to be beneficial to your pet.
And I'm really glad that you have the ability and the guts to say this, because I don't have the academic training, you know, the further qualifications, the experience that you do. So to be able to confidently say that is fantastic for me, because quite often I feel like I'm behaving like a bit of a vigilante when I'm not. I just, you know, when you see it and you're upset by it when people say, what about this food? What about this one? What about this one? You're like, oh my God, it's just a swamp. It's a minefield. And it's really hard to advise people.
Well, and that's the thing, you know, it gets to a point where you just have to be blunt about it. And, you know, it's hard. I remember when I was first out of school, it was really hard for me to look at a dog, you know, this heavy Cocker Spaniel whose belly you couldn't even see any light under because its belly was so low. And mom and dad are weighing in at 450 pounds each. And you're like, what am I supposed to say? And now I'm like,
they go, so would you like to put me on a diet too? And you're like, yes.
And the thing is, I'm like, look, you're paying for my opinion. You want to come and see me as a professional? Your dog's fat. Your cat's fat. If you want it to be fat, then you're going to have to be dealing with the consequences. I'll help you as much as I can, but it has to be a team approach. And that team approach, that multimodal approach, is whether it's among colleagues and owners and pet parents, but also at a multimodal approach at a molecular level. Because when we talk about supplements, if you look at studies for like just, you know, chondroitin alone, it's a mixed bag of results. Glucosamine alone, mixed bag of results depending on which study and which doses. But when you start to look at a supplement that has 5 or 6 or 7 different things in it, it's a little harder, unless you get a specific research paper on that product, to get its efficacy. But it's those working together, that multimodal approach, that we know helps the joints the most. Okay. Because the joint, the cartilage is not just made out of one thing.
We have had a number of people saying, so what are these 2 supplements? And CAM is always in a very difficult situation because we don't take any financial support from any company. We have no vested interest, we have no bias, we just try and stick to fact. If you're sticking to facts and you don't have vested interest, are you okay to talk about what ones you recommend?
Yeah, I can. You know, I mean, I've got into learning about rehab and supplements a long time ago, and I started to make my own opinions. And then, so disclaimer, I do some speaking now for a couple of different companies on the rehab side. Some of them are nutritional supplements, some of them are you know, different laser companies or other rehab products. So I have those disclaimers, but I also made my own informed decisions before I started working with those companies.
Yeah, it's a tricky thing because, as you say, I will say this, you know, we recently did some work with Hills, who have got papers to prove that their JD has clinical benefit. But I knew that way before I wrote it into the original CAM website. I do not feel guilty taking the support that they've given us in lecture opportunities. So it is a really difficult area when you don't want to be caught out for looking like you're vested interest in yourself.
Right.
But can you use the generics? Sure. What generics?
Well, so that's the hard part, is the generics are a toss-up because everybody can get into them, and we don't know their source and their efficacy. You know, I think everybody should make their own informed decisions, and there are a number of good products out there. It's not that the ones I'm going to recommend are the only ones I would ever use. It's just the ones that I have finally gotten comfortable with my practice and I stick with. But I have colleagues of mine that use some others. So
we're going to leave you to sleep on it, and if you feel that you're allowed to say what you use, then we will do. But let's move on.
I speak for Nutramax, so I prefer their Dasequin and Wellactin products. Mm-hmm. A very close colleague of mine that I trust a lot has really good results from the Glycoflex products. So those are probably the two big ones there. And then on the food side, Hills, Purina, and Royal Canin, I trust all equally. I've seen good results on all of their food.
They've got very different approaches, haven't they? Hills is very much like the nutrigenomics and the omega-3s, EPA, and Hills, no, Royal Canin is the green tea phenol.
Yep.
But they're stuck because they can't talk about it being a mobility diet anymore, can they? Because of, yeah. What's the Purina?
It's the logistics.
Yeah.
Purina's got another good work on the omega-3s as well. And the thing is, all of those foods, the thing that I like about all those companies in general is that they all have direct veterinary nutritionist oversight. They all do safety checks and quality control on a regular basis. I know where all they know where all their source material is coming from. So those are the ones when I start to look at stuff that I know are my reliables. I think that there could be some other things out there that may come around that are good, but right now, like some of these boutique diets that are out there, sometimes don't have that oversight, or don't have that level of quality control. It's not that they're out to make a bad product, but what are we starting to see now with some of these boutique diets? That certain lines, and it's not necessarily that it's grain-free is the problem, but in certain one of these boutique lines, we're seeing what's called dilated cardiomyopathy, or DCM. And we've seen it in dogs as young as 12 months of age, and it's been potentially fatal. And we don't know exactly what's causing it. Similarly, this disease was found in cats in the 1980s, when we thought cats were just small dogs. So when they made cat food, they just made it to the same nutritional requirements as dog food. And cats have a much higher requirement for taurine, which is an essential amino acid in their diet. So if we don't feed cats enough taurine, their heart would get this disease where the muscles get really flabby and can't contract well. We've solved that in cats. Looks like we're all good with cats now on that. But now in the last couple of years, it's crept up in dogs. And they're not sure if it's taurine or not. The University of California, Davis Veterinary School, their cardiology team is one who's found most of this now, and they're working in the United States with the Centers for Disease Control and the USDA, because we're starting to look at all these in that there's something in some of these diets that even if they have the right amount of taurine, that doesn't seem to be maybe necessarily getting absorbed into the dog, and it's not getting into their heart muscle. And the hard part and the scary part with this, and talking to my cardiology friends, is half of those dogs that have a problem don't have an audible abnormality when we listen to their heart. So the normal heart, when we listen to the heart, should be lub-dub, lub-dub. And if we hear a problem, sometimes it'll sound like lub-shoosh, right? Like a leaky valve. That's not necessarily the case with DCM. So being really careful from a rehab perspective, I have to be cautious about dogs that are on these kind of boutique diets, because if we have them either undergoing anesthesia for injections or surgery, or we have them in the underwater treadmill, and we're pushing their heart to build their muscles to help their arthritic joints, well, what if that heart can't beat appropriately? No. So this whole nutrition aspect is a huge growing thing that we have to work on as a team.
And we've got some people here, and let's do this, because I don't try and run away from these kind of questions. You've talked about being aware of heart conditions with rehab. Something that I'm just going to tangent across to is the raw food feeding. So I've done a lot of work experience in different rehab facilities around the UK, and a number of them won't actually allow raw food fed dogs to swim because of the fear of contamination within the water. So you Campylobacter, Salmonella, E. coli, etc. So that's my little tangent across to raw food. Now I'm going to be really honest about the raw food thing. I don't think we know enough yet, and I think there's so much variability in what people consider a raw food diet. There's no consistency. Everybody has their different recipes, everybody has their different menus, everybody has a different strategy. I think for me, because I've spent a lot of time thinking about this, and I read all of the articles that come out in the veterinary press about raw food, there definitely seems to be more understanding that owners want to go down the raw pathway, and that's fine. And I think the veterinary profession are beginning to be more supportive of that. But the real truth is we don't know what you're putting in your raw food diets. And there's many raw food companies coming up, which is in our chat about boutique diet companies. We would classify them into a boutique diet company because we don't know what they're doing. We don't know what they're putting. We don't know the level of academic qualifications for the people that they're referring to for advice. So I think, to just answer that question, it's not that we're against raw. I just don't think that we can advise you well enough with it. And if you choose to feed raw, then I would just suggest that you make sure it's balanced to the best of your ability. And I'm going to really big up Tufts University because they do balanceit.com. So they are independent, board certified. I think there's 3 of them, aren't they, in that lab? And they make balanceit.com, and there's no marketing. It is what it is. They're trying to make a supplement that can ensure that your animal is getting all of the nutrients it requires. Because I've seen dogs that are just fed lemon chicken breast, and they're a disaster, you know. So back to, if you choose to do raw, you know, obviously look into your hygiene, best quality ingredients, take advice, try and ensure that it's balanced, but also it comes back to weight. And I've seen many dogs that are on the raw food diets are overweight, and people do have a belief that if you're raw fed, they just automatically go back to the perfect size. They don't. It's like any food. Anything you put in your body has a calorie count. So don't think that raw is just going to do all of the hard work for you. I totally respect if you want to do that, but it's very difficult for us to advise. It's a very new area. It's literally been in the last 5-10 years that it's kicked off, isn't it? Is it big over where you are?
I think it's been maybe a little bit bigger over here. I think a lot of it, you know, it became boutique, but there was some areas, you know, where did we have a raw food staple was actually sled dog racing. So the Yukon Quest, the Iditarod, these 1,000-mile sled dogs, you know, these dogs are not people. We anthropomorphize, we love them as family members, and they absolutely are our children. But just because they're omnivores and we're omnivores doesn't make all omnivores created equal. So, you know, from a sled dog community, you know, sorry, let me back up. When we work out, we need carbs every 45 minutes or so in order to keep ourselves going on a marathon or long endurance, okay? When a dog's running, it doesn't need carbs. It needs fat and protein,
Right.
okay? And so when you have the Iditarod or the Yukon Quest, which is actually where Dr. Washlag and I went up for my research project.
Oh, wow.
You know, so there we're feeding these dogs tons of meat, most of the time raw, because you have to get the calories. They're literally feeding, you know, fat and protein because you don't need the carbs on those long races for those dogs. But you have to tailor to what the dog needs. So yeah, I agree. We don't know enough about raw. To me, raw is just like joint supplements. Who's making it? Who oversees it? What's in it? We don't have a clue. And when we don't have a clue, we get really reserved and we don't want to overstep our comfort zones. So I think we do have to learn more. I always agree that it has to, if you're going to do a raw diet, it has to be done by a veterinary nutritionist. Otherwise, you will hurt your dog or your cat.
And that's where it's really hard to find them. And I'm going to be really honest. People say, you know, vets don't have a huge amount of nutritional training. I would say, in the big scheme of things, no, we don't, because we're already learning about, we're doing orthopedics, and then we're doing urinary health, and we're doing spinal disease, and we're doing, so come on, guys, you know, there is only so big in this space here. But veterinary nutritionists that you can go to are quite hard to find.
Well, and that's the thing, because the thing is there aren't that many of them. So if you go, I think the European College has it as well. It's the American College of Veterinary Nutrition, or you can search the European College of Veterinary Nutrition. Those are the specialists. But the helpful thing is just like we're communicating now, most nutritionists don't actually need to physically examine your dog or your cat. You can show them a picture and go, okay, yeah, you're fat, okay? Or you're trying to set up their goals. So I actually have a bunch. Tufts is great with Balanceit. The University of Tennessee's vet nutrition department, Cornell's vet school's nutrition department, University of Florida has a veterinary nutrition department, and there's a group, Dr. Danielle Conway, up outside of Boston, Massachusetts. All of them do telemedicine consults.
Oh,
which means you
really?
can be
Oh, wow.
anywhere. You can be anywhere in the world. You can go onto their websites and contact them. Your vet can send in records. You fill out a history form. You pay them via the internet, and you get a full nutrition consult with these folks.
Can you
And
email me
they,
that? Because I'm going to do
yeah,
it with my dog, and I'm going to see how
yeah,
easy it is. Luna,
yeah.
you're being trials on again.
It's super, and they'll do it for, you want to just work with commercial diets, you want to work on raw, you want to work on home cooking, you want to do some combination of those. That's their specialty. And in this progressive area where everything's expanding exponentially in knowledge, go to the folks that do it every day. Those are the ones that are going to have the most comfort with it.
Yeah, yeah. Cool. It's all kicking off here. You probably can't see it, but as always, it brings so much heat into any discussion talking about diet. So I'm going to leave diet with this take-home message. There are many, many ways to feed your dog. Everybody that buys food for their dogs does it out of love. They want their dog to have the best. There are different levels of input. I don't feed raw and I don't feed home cooked because currently I'm living in a camper van and that just ain't possible. I feed kibble quite comfortably. I trust the provider of my kibble. It's a choice, and I think let's leave it here that the only things that we know with relevance to arthritis is weight control, is the omega-3 fatty acids. They have to be in a certain ratio, so just whopping loads into the food isn't necessarily the right thing to do. We've got ASU, the avocado, soya bean, and I can't say the second bit. ASU. Glucose and chondroitin, which the jury's still, nah. There's many more out there that still have got to prove themselves. And I think let's leave it there. Let's go on to something that we find more interesting right now. Come on. Let's now talk about your job. So you're working where at the moment?
So actually, I'm in Maryland, but I'm in a bit of freelance. So I now do some work for a couple of different consulting companies and do some per diem work in helping out a couple of different practices.
Okay. And so what kind of stuff are you doing? So I'm going to pose you a dog. It comes in. It's going to be a typical 10-year-old black lab, male, neutered, body condition score 7, bilaterally lame in the forelimbs. Actually, no, it's just got economy of gait all over. And the owner has the ability to do a full workup and employ the best therapeutic care. So just talk about what kind of things you would be doing in your world for that. And then we're going to go to the complete opposite.
Absolutely. So if we've got that chubby older Labrador, let me throw it at you. We're going to assume that he has elbow or degenerative elbow disease, right? Elbow dysplasia.
We've probably got a little bit of back end issues.
Yeah, we'll get to that. But let's assume, has he had his elbows scoped and cleaned out yet?
No, he's had nothing done.
Okay.
Straight up the street.
All right. So here's where we have to figure these out. So when I look at them, we're going to do a lot of things. We're going to do a lot of talking and listening and getting their history and stuff. My consults are usually 60 to 90 minutes. So we cover a lot when we go through stuff. We're going to go outside. We're going to watch the dog walk back and forth a couple of times. I have to see how they're moving, what they're doing. I'm going to do some functional tests. And then I'm going to do a whole physical from their nose to their tail, covering, of course, their heart, orthopedics, neurologic, all those things, making sure that everything's in shape. Yeah. And then figure out where our problem list is and what's right and wrong. From there, we're probably then going to talk about, well, let's assume that we've got some elbow arthritis, and that's our major player. But gee, when we go to engage the biceps in the shoulder, he yelps out too. But we're going to say that the neck is fine, and neurologically he knows where his feet are in space and time, and all the rest of him, for the moment, other than being chubby and stiff, is not a problem. So I'm going to look at those guys. I'm going to go, okay, how do you want to approach this? Because we can look at this and we can go, okay, let's go get a CAT scan. Let's go look at those elbows in depth. Are we thinking about having you go to see a surgeon to do arthroscopy, to put a camera in, to look around, to see if we need to smooth off an edge of that coronoid? Is there the proverbial pebble in the shoe? Is there something mechanically obstructive here? This gives me a chance to show, by the way, if your elbow works fine, you should be able to pat yourself on the back. Same thing with your dog. If you can't get your dog's wrist to touch their shoulder, there's a problem here.
Oh, that's a good one.
It's a straightforward one. So if they can't go upstairs as much, they can't bend as much. All your dogs should be able to have their wrists touch their shoulders. Okay, it'll be pretty close. If you have one on one side and one that stops here, there's a problem here, just like a door hinge. Okay.
Yeah. And guys, if you can get at home, don't make it go there. If there's resistance, this little test at home, don't force it. Okay, just good.
Gentle touches. Absolutely. So we're going to get that. We're going to say, well, do we want to go in and get a CT and do arthroscopy and clean those out? Or let's say for this sake, let's say that was just done 2 years ago or a year or so ago, and we've got good motion, but they're stiff and sore, and they walk out of it, but it takes them a while. And it's the dog that already comes in taking carprofen twice a day and a good joint supplement, and they're trying to do all these things. Mm-hmm. So I'm going to look at those and go, well, we want to get a new CT or at least some radiographs of the elbows. Make sure that we're not missing anything else. What's kind of changed as far as appreciating the level of arthritis? I mentioned that the shoulder would be sore. So we'll probably get some radiographs up there too. Okay. Again, I don't make assumptions in my world. I always tell everybody, all my externs and students that are always in with me, all learn my little quips. I'm not Superman. I wasn't born on Krypton. I don't have X-ray vision. So I want to get radiographs to know that the bones are okay before we do anything else. Yeah. Is there an infection? God forbid, is there a tumor starting to grow that we're going to miss? Yeah. So let's say that the radiographs are fine, but those man, why is that shoulder so sore? So what I'm going to do next is a diagnostic step, aside from getting our complete blood counts and chemistries and urinalysis to make sure our body's overall healthy, is we're going to do, and most of them I can do it awake, we're going to do an ultrasound of both shoulder joints to compare, and we're going to see what the supraspinatus, the infraspinatus, the biceps, the medial glenoid ligament, all the little structures in here, we're going to see how they do and what's going on. And just like a sonogram where we can see a kidney or can see a baby growing, I can see those tendons. And are those tendons normal? Are they hanging on by threads and about to tear? Or are they just plump and thick and aggravated? What's going on there? So we may get some tendinitis. And now I'm going to come back and go, okay, mom and dad, here's what we've got. We've got an older chubby kid who, for right now, I don't see anything directly surgically wrong with. Okay? How do we want to approach this? And, dad's kind of quiet in the corner, and mom goes, I don't want him to take carprofen every day. I'm going to go, okay, I think we can try to get to a point where we may have to take it once in a while, but if we're going to do that, I can help the joints to feel better, but we're going to have to make them stronger and skinnier. Okay? So how am I going to make them more comfortable? Because if the elbows are the major problem, but we don't have a mechanical obstruction, then what we're going to do is we're going to inject those joints. Most of the time under light sedation, going home that same day, we're going to put something into those joints to make it feel better. And we may have to put something up here in the shoulder, either into the tendon or around the tendon into the joint. And those are to be a targeted anti-inflammatory. Yep. And the whole point of that is, instead of having to take the pills for it to get into the stomach, the liver, the bloodstream, and into the joints, we're going to put it right where the problem is. Yep. And when we do that, we're going to do it pretty easily. I'm going to put a needle in. We're going to pull out all that joint fluid. Just like I took my car to the dealership today, you have to do an oil change. We're going to get rid of all that inflamed, cranky, worn-out joint fluid and put something better in. What do I put in? This depends on what our goals are, what our budget is, what the level of disease is, and what's worked before or not. Because there's no one product out there that 100% works in every patient. Right? Yeah. Doesn't happen.
So what we're talking about, anything from stem cells all the way down. Steroids.
So we may go to stem cells, and usually I'm going to do that. We're going to do bone marrow derived stem cells, and we're going to combine that with platelet rich plasma, and we're going to do it as a one-time injection to get about 12 to 18 months of relief. Okay? Depending on the level of the dog and how they averagely respond to it. Yeah. But if it's less than that, we may just draw their own blood and process what's called PRP, or platelet rich plasma. So we get rid of the red blood cells, most of the white blood cells, most of the liquid, and the platelets have the body's natural anti-inflammatories. So we can put that right where the problem is. And those trigger, we have what's called alpha granules for all your science nerds out there. Those alpha granules are then our anti-inflammatory helpers in the joint.
Yeah.
We may do it as a one injection, or we may do it as a series. So those are my biologic options right now. I'm not an equine practitioner, so we can't use IRAP. We don't have IRAP yet for dogs, although I keep hearing things, so that could be something new out there.
Yeah.
And then we can also look at pharmaceutical things. So pharmaceutically, we could inject steroids. The helpful thing with those is they're big anti-inflammatory. The not so helpful thing, some of them are, while they'll take away the pain, sometimes they also take away any remaining cartilage.
Right.
So it depends on what steroid and what age of the dog and what we're responding to. I usually combine a steroid with hyaluronic acid. So it's synthetic joint fluid. I always put those two together because we're going to get a longer lasting effect. In people, we may do HA injections, most of the time for knees before they'll let you go and have a knee replacement. You know, they'll do, well, does it feel better? But for HA injections, we either have to go once a week or once every other week for 3 or 4 injections. And to me, that's not really practical on a canine side where we have to sedate that dog every time, and cost-wise to only get maybe 4 to 6 months of relief. So I will usually take hyaluronic acid and steroids, one of 2 different types, depending on the level of disease, put that in there, see how they respond. Or we've done something biologic. So they go home, they rest, then come back about a week or 10 days later because they should be feeling better. And now they start to work with my nurses. And we get them into an involved home exercise, weight loss, and strengthening rehab program.
Yeah.
And that's going to take us about 3 months. Okay, because everybody knows right after the holidays, right? When does everybody go to the gym? January 2nd.
Yeah.
But by February 1st, all the gyms are empty again, right? But you have to stick with it. So when we set up a consult to then figure out how to manage that arthritis, manage the key, right? Short of a total hip, total knee, total elbow. Dr. Fitzpatrick over in Surrey's doing total shoulders now, right? He's doing. Oh yeah. Hi, Dr. Fitzpatrick. Yep. He's doing shoulders. And there's a few people in the States that are now learning to do total ankle replacements in dogs. So short of a significant financial investment and a major orthopedic surgery,
and
we're always managing.
They don't
and a major rehab.
Wake up and start walking.
Right. Nope.
Let's put it in perspective.
But a major, all those management is what is not a surgeon's job. The management of those diseases is the VSMR jobs. So we go look at it and go, we're going to make it, we know what it is. We're going to make them feel better. We're going to make them stronger. And then we're going to re-inject if we need to. I have some dogs I inject once their whole life because they lose the 20 pounds they were supposed to lose. Or I have some dogs that we have to re-inject every year or so. Yeah. Or I have some geriatric dogs. There's some dogs I can inject joints awake. So they're 12, 13, 14 years old. They have really bad heart disease. Can we get something into that joint to give them some relief in their elder years, depending on what our goals are? So it's a lot of talking. It's a lot of puzzle solving and tailoring it for everybody individually.
So just so that I can put a kind of UK spin on this, I've worked in a lot of practices. I was once at a job interview and they asked me if I was flitty because I'd worked in so many places. But that gives me the benefit of being able to say that there are a lot of practices in the UK that don't offer that form of really tailored, really focused therapy yet. I think there's a lot of fear of joint injections. I think the literature that's about is not very comprehensive. It's only just becoming more comprehensive for your veterinary practitioner to feel that they trust it and they feel that that level of intervention and financial intervention is worth trying. I think there's something really different from a first opinion vet's confidence in grabbing a non-steroidal and confidence in saying, I'm going to take your dog, I'm going to sedate it, I'm going to inject something into its joints. I don't know if it's definitely going to work. That's a very difficult thing for a first opinion vet behind that table with the eyes of the owner on them. This is my my fur child, and you're saying, right, I'm going to spend 800 quid to sedate your dog, inject its joints, and it may or may not work. So just be kind to your vet. Please tomorrow don't go in to your local little practice in Yorkshire and go, I want my joints injected. I think it's the sort of thing that you say, I've heard about this. What are your thoughts and feelings? I've actually moved to Scotland from Brighton. It's 780 miles, so that I can become more competent in this area of medicine, because it isn't very it's not very prevalent yet. But let's take a concept of something that you mentioned, is that you're injecting the joints to try and relieve the pain to the best of your ability to allow that dog to get into a rehab plan. So let's take the disease modifying side of the stem cells, the disease modification potential of the PRP, and look at the pain management of the intervention, and the fact that it's opening you a window of opportunity to try and influence joint mobility, function, movement, proprioception, weight loss, quality of life. Is it fair to say, for those people that don't have access to that kind of intervention, we've got some followers, in the deepest, darkest depths of Canada, in New Zealand, we've got followers all around. The same kind of understanding can be facilitated with the use of non-steroidals, adjunct medication, physiotherapies, potentially, all the rehab tools that are available to us. We're trying to control pain so that we can improve function and improve quality of life. So is that fair for me to just do that as a safety net?
Absolutely. The thing is that most of the things that I can't see every dog. Our primary care veterinarians, I was one of them. I have tons of friends that are, when you're seeing, 3 or 4 patients in an hour and you have a busy day and you're changing hats, your dentist, your joint supplement, now you're your cardiologist, now you're the ophthalmologist because you're bouncing from different exam rooms, it's hard to know all this information. So to get in there, to be comfortable with these, then the ones that get to us as specialists, those are a small percentage. So we want to get everybody more comfortable with different medications that are out there. And I equate it to this. If you have 6 people in a room, okay, everybody's relaxed, hopefully relaxed, but let's say nobody is. Let's say you have 6 people, everybody has a headache. Well, maybe I take acetaminophen. Maybe you take ibuprofen. You take something else. Somebody in the corner goes, I go and I get acupuncture. Somebody else in the corner goes, I pour 2 grams of whiskey and go sit.
Rollerballs and stuff and things like that. Yeah.
Because the thing is that all of us are different. And the original studies on ibuprofen, okay, on the human side, okay, in order to get approval for use, only were effective in 84% of patients.
Really?
Okay? Right. Carprofen works in 85% of patients. Acupuncture works in about 85% of patients.
Oh, that's a tricky one. Okay, let's stop. You've done it. You've got to stop there. You've got to pause. That is such an area of in the UK, because a lot of our advisors, so I'm really, really lucky that people like Louise Clark, Gwen Covey-Crump, Ian Self, Matt Gurney, they've written for us, they contribute, they're amazing people, and they all do acupuncture. But if I dared put about acupuncture on a veterinary platform, there would always be the vets that go, no, it's just placebo. Are you guys using acupuncture?
So we're using acupuncture a fair bit. It probably makes up about maybe 15% of my practice right now. I love it on cats if they'll sit and be comfortable, because if I can't put needles in, I can either inject points with like vitamin B12, or we can put in, we can use the laser. So we can use our cold lasers and use them as laser acupuncture points for cats. Yeah. There's some really good papers on for acupuncture for pain relief. Yeah. And I think that you can use it in a balanced approach to help the body to release the natural endorphins and get some help with that. Now, is it enough is it Atlas holding up the world all by itself? No, it's probably not. But I think that it's a good component to these that have failed or have not responded to other methods of trying things. Yeah. So to get into this area, it's trial and error. Because I could look at a litter of golden retrievers. Yeah. Let's say they all had elbow dysplasia. They're all 3 years old. They all have bad elbows. If I have a litter of those dogs, probably some of them are going to improve really well after arthroscopy. Some of them are not going to respond as well. Some of them may need stem cells. Some of them may do just fine on carprofen. Everybody's a little bit different. So we
Can
have
I
to
butt
figure
in
those out. We
again?
have to give them time.
Can I do the arthroscopy questions? There was a paper out not
Oh,
too long
sure.
ago about elbow arthroscopy compared to conservative. Now, obviously, this is of
Uh-huh.
interest. This is of interest in the
I know this
world that
paper.
I'm heading into, because obviously I'm now working at a practice that's doing much more of the regenerative. So that kind of pricks up your ears, and you're like, "Oh, this is exciting," because elbows seem to do quite well with regen, especially if you treat the shelbow. That I've stolen that from Andy. I don't know where he stole that from. But you know, if you've got an elbow problem, you really do need to be checking out the shoulder because they're so highly interlinked. Um, what do you think of that paper? Are you like it?
It, 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 it's a good paper. And the thing is about that, so let's cover a couple of things. Yes. When I think about it, we have a lot of dogs that come in that'll have elbow problems that have secondary shoulder issues because they're compensating. So in my world, if they have elbow and shoulder pain, I ideally like to ultrasound or get a better understanding and imaging of the shoulder before we go in on the elbow. And
Yeah,
think about it too, your biceps starts up here, whether you're a dog or a human, and inserts down here.
yeah,
So just because you get some pain, you could have biceps referred pain from either joint.
yeah,
So I look at those and I go, all right, well, let's try to get as much information as possible. And then if it's a young dog, okay, and we can see it because there was another paper that looked and showed that plain x-rays are not our best method of understanding elbow
yeah,
disease.
yeah.
CAT scan. CAT scan gets us better information than plain x-rays, but still doesn't get us as good information as arthroscopy. And MRI is not.
Isn't there also there's different levels of CT? Like there's 16 slice and there's 32 slice, and then there's MRI plus CT, and then there's CT plus arthroscopy, and then there's pin scopes with oh
And the thing is, when we have so many variables in the equation, if we change them all at once, it's hard to know what's really getting our best information, our best treatment. So when I look at an elbow, I go, if it's a young dog, if finances allow or insurance allows, do the utmost at the beginning. Because elbows short of a total elbow replacement,
yeah.
okay, which are currently running, I think, $20,000 in the States per elbow, 15 to 20, okay,
Elbow.
per
Christ.
elbow, okay.
Sorry, any people
Nope.
that I
But the
swore.
thing, it's a lot of info. We're always managing elbows. So I look at those, and since we can't get a ton of information from X-rays and CT,
Yeah,
CT may help us as much. In a young animal, I'm going to say go in and scope it if we can, because if there's a fissure and there's something that's tumbling around in there, if you guys all go out hiking this weekend and you get a pebble in your shoe, what do you
yeah,
do? Do you keep the pebble in there for 12 more hours or 2 more years? No,
no,
you're going to have a blister and your foot's going to rot off.
yeah,
So you go, you stop, you take your shoe off, you take your sock off, you get the thing out, and you go walk again. You may have a little blister, but it'll heal. So in a young animal, I ideally still say go in and scope. Know what we're dealing with, get photos of how bad the cartilage is, and if there is a fissure or something that can be done there, improve on it. Now there's
yeah.
even other procedures like the Q, not the letter Q, but CUE,
Mhm.
which is a partial elbow replacement type scenario. And I know that between Dr. John Dice here in the States at Ohio State, Dr. Daryl Millis, Dr. Denny Marcel and Little, and a number of folks down at the University of Florida, they're looking at all sorts of things for elbows, and Michigan State's vet school. They're looking at a ton, and I know, of course, Noel Fitzpatrick's looking at all sorts of things to try and help these, and folks
Yeah,
down in Australia too. So I still say in a young dog, scope.
yeah.
If you have an older dog, and you can get pretty much a good range of motion, but they're stiff at the end, and we have x-rays that show we don't have cancer, we don't have infection, we don't have things like that, well let's try some things. And
Yeah.
then if those fail, then we have arthroscopy to get us back
I
somewhere a
think that's
little
a
bit
fair, I
too.
think that's a fair game. And I think what's lovely about what you've just said is that you've made it really clear that there is still much to learn. It's not like hip replacements where we
No.
have, I think it's a 95% success rate. It's
Oh,
it's
yeah.
it's hugely well practiced. confidence. It's available for cats now. You know, these people are doing this on a regular basis. I think elbows, Dr. Karen Perry sent me some paper from Michigan, and then I looked at Professor Richard Meeson, the UK study. There's still really unsatisfactory results with elbow replacements. I think, and it's quite
Yeah.
You know.
Yeah, no, it's not one we jump into lightly.
No.
We've sent one dog for an elbow replacement in the like from the things I see, and you have to really have the right scenarios and the right setup. So I think the more that we can learn, the thing is, so that going back to the paper that you mentioned, you know, they looked at it and said, well, if we scope them, do we get the same outcomes about 90 days later? Because we know those dogs are going to get worse for a while.
Yeah.
The thing that I didn't like about that paper was, Hannah, did they include rehab in that?
No.
Okay? They scoped them all. And I love our pet parents. But when you have 4 kids and you're getting off to soccer matches, or you're getting to baseball, or you're getting to piano, or you're doing all these other things, okay? Yeah. As a rehab, we need, you know, if you guys have ever gone out and you've had, or your parents have had a knee replacement, you have to go to rehab. You've had a valve transplant or a valve replacement, you have to go to rehab. So you have to rehab these dogs. And at least in the US, when I looked at that paper, I also, you know, it was in my other hand at that same time as I was reading that paper? 2 out of 3 dogs in the US are fat.
Yeah, no.
Okay, so we have to work on body condition score. We have to work as a team. I think I would love to redo that elbow paper if we took half the dogs and rehabbed them and half the dogs and didn't rehab them.
Yeah.
You know, because those are the things.
Absolutely right. I think, so for all our followers, rehab is actually really quite new. So don't be offended, physios. We have a load of physios that follow this page, and they're fantastic. And I love the fact that they contribute. So just for you followers, physio's been around for a fair whack of time. To say 20-25 years, veterinary physiotherapy's been available, but it really hasn't been well utilised. Let's be honest about it. You know, the vet profession have been a bit cynical and a bit slow on the uptake. There's now a real strong push in the UK with veterinary physios. There's a number of qualifications, high-level qualification, not a Groupon course for $19.99 that you can learn in 2 days, but we're talking a 3-year degree kind of qualification. But also there's a really big developing field in veterinary medicine that's almost kind of like in between delving into the physio, but with more tools and more interventional, isn't it?
Right, and that's the thing. In the States, so interestingly, in the States, we call it physical therapy for humans, but I can't call it physical therapy. I have to call it veterinary rehabilitation. So we shorten that to rehab because, and I work with a number of fantastic PTs, but in the bylaws, you have to watch what you can call it. So we call it rehab. Now, I know in the UK, it's more physiotherapy. So I look at it, it's all this team approach. So the physios, and so I'm a member of the IAVRPT, the International Academy of Veterinary Rehab and Physical Therapy. I'm on the executive board, and we have a ton of amazing people from 6 different continents. Like when we get a meeting together, it's 6 continents represented because nobody's on Antarctica doing rehab. And we cover 95 countries. And actually, we're going to be in Cambridge this time next year. We're going to be in Cambridge in August. But, you know, so our physios it's all this components. It's veterinarians, it's veterinary nurses, it's physios. I know the ACPAT in the UK is a huge component into really making sure that veterinary physio is done appropriately. My dear friend and colleague, Diane Meeson, is down at Davies Veterinary Specialties right outside of London. Di's great. You know, there's all these components into getting the aspects of what we need accomplished for our kids. And we have to utilize that because they've got great techniques and tools. And, you know, no offense to the surgeons. And I work with them all. I love them. Not everything gets solved in an operating room.
No.
And a lot of things can start a good setup, but we also know that, you know, if we fix a fracture and somebody doesn't pay attention to that pet and lets them run around loose in the yard 2 weeks later, we're going to have a surgical catastrophe or a surgical setback. It's not the surgeon's fault. So it's good communication. When we set down rules about leash walking and crate rest and things, it's for a reason, but it's also because we want to get back to doing fun things.
Yeah.
And I always say for everybody, we get this team approach, it's a short-term loss for a long-term gain, and let the specialists in those different areas do their jobs.
I like that. Short-term loss for a long-term gain. I like that. I'm really aware of time, and I want to also make sure that we give people proper take-home messages. This is the point of camp. It's available for everybody, from your pensioner in Crawley who's fat staffy, still jumps on the leather sofa off of the laminate floor, and he wants his dog to get better, all the way through to your person that's got a £14,000 credit limit on their insurance. We want everybody to get some benefit, because I was there. Have you had a dog with arthritis?
I have. Yep.
Yeah, it's crucifying, and sometimes I would suggest the more you know, the harder it is. I'm not shy of telling people I spent £2,500 in the last month of Holly's life, in that I tried everything, because I knew that there was all these things. I would try them. And for me, I want Cam to appreciate that this is a really vulnerable time in ownership. So we're going to do 10 things, quick fire advice that you feel is imperative for every case, no matter your financial background, no matter your physical capabilities, no matter where you live. You know, so this is all things that if you were in the deepest, darkest depths of Canada, you can do. So we're going to take your turns. You go. You're number 10.
Number 10, stay lean. No fat dogs.
No fat dogs. So we want you to feel behind the elbow, and we're going for Matt's nice knuckle thing. Okay, so my one is flooring. I'm all about the flooring. More rugs, less drugs. It's the way forward. Please consider these micro injuries that are occurring where they have lack of proprioceptive capability, lack of stability, and they're slipping out or they're even falling. It's just disaster.
Be proactive as much as you can. So join supplements early, and getting out and for regular exercise, getting a plan in place, knowing what's going on. So be proactive.
My next one would be, don't wait until they need the aid. Step in sooner. So I hate seeing this when you see dogs that are really struggling to coordinate their back end with their front end, and it's like a drunken back end with a strong front end that's just keeping it together. Use your support harnesses. Don't let them struggle, because you're just creating secondary problems. Be constructive with your exercise plan. Don't wait to get your orthoped's help them up harness. You know, get in it early. You wouldn't wait until your grandma couldn't actually pull herself onto the Zimmer frame. You'd give it to her when she was able to use it. So have the same concept.
Right. Next one I would say is staying clean, right? So being smart about things like this. Dogs' nails should be equal to their pads. So when they hang over like this, it's like us trying to walk around in stiletto heels. Okay? So keeping their, finding a way to keep their nails short, balanced to the pad, shave the bottoms of their feet. If they have the dogs with all the tufts of fur, then it's like us walking around the house in slippers or socks. They can't get traction. So shave their feet, keep their nails trimmed. And along with shaving feet, like I had a Newfoundland who had arthritis, and when she was in full glory Newfie coat, she weighed 125 pounds. But when I trimmed her down to puppy cut, she weighed 105 pounds. 20 pounds of fur. Okay? So for these, especially for these arthritic dogs, don't be afraid to go get a buzz cut. Keep it lean.
Interesting. We were joking that for our clients that don't buy into weight loss, we were going to create one of those kind of like ammo jackets with loads of weight in it, and just say, can you wear that for a week? See how you feel. Yep. Because I think they did it years ago on some kind of rom-com where the men had to wear a pregnancy pouch to sympathize with their wives, didn't they? Yep. We were gonna get owners to sympathize with their dogs. Okay, so that's number 5. Number 6 for me is to remind people that acute pain causes vocalization, chronic pain doesn't. Please use your noddle. Okay, if you look at something and think, oh, that must have hurt, it did. Okay, so it really breaks my heart when people see their dog fall over or struggle, hesitate, really find something quite difficult. And because they don't vocalize and they just walk away from the incident, they assume it's done no harm. I can assure you it probably has. So if you think that must have hurt, it has done. Look ahead, think, how can I prevent this? Plan ahead. Yours next.
Age is not a disease.
Yes.
Okay? Old dogs should still be up and mobile. Okay?
Yeah.
So age, just because they're old, doesn't mean that they're worn out. Okay? Like I said, I run marathon. Okay? I ran the Marine Corps Marathon here in Washington, D.C. last year.
Good.
I was 39 at the time. Okay? And I got passed. And I got passed by a 65-year-old woman. And how do I know she was 65? Because the back of her jersey said, "Congrats, you just got passed by a 65-year-old grandma."
Oh my God, that's amazing.
Okay? So age is not a disease for any of us. Should still have expectations, still get up and do things every day.
And I really agree with that. So we were talking at a CAM lecture recently. When Holly was 13, she had a hepatocellular carcinoma, and people said, it's time to let go. This is huge. It's not going to be easy to resect. It's pretty much just pressed right up next to portal vena cava. And I chose to go through the procedure. It cost me £10,500. It was pretty scary. It was a 50-50 chance, but it was my choice because her age wasn't her disease. She still had a life ahead of her if she survived. So please, it's your choice. And if you feel that you want to do an intervention that you feel is appropriate for your dog, then don't let their age necessarily put them off. Okay, that's a good one. I like that one. Number 8 for me is interactive feeding toys. They are amazing, and do not underestimate what power they can have. So there's a brilliant lecture on YouTube. You can type in chronic pain, and I think it was the University of Michigan. The dude's got grey hair and glasses, and it's aimed for humans. And his take-home message after an hour and 15 minutes is distraction, activity, and sleep are extremely powerful for chronic pain management. Well, you've got distraction and activity by using these interactive feeding toys. Do not doubt what they can be doing to improve the quality of life for your dog, the mobility, so all of these movements are low impact. Just think about digital OA with a dog putting their foot around a Pong to try and keep it in place. Think of the movements through that elbow. You're just getting slight, gentle, low impact movements. It is a tool in your multimodal management. Number 9.
I love it. And well, I'm going to add on to that. I'm going to say, though, look where you are feeding and where the water bowls are.
Yes.
Because oftentimes, for convenience, we keep them in the kitchen or in the, the mudroom or something. Think about the traction in that area. Yeah, it's really easy. People have lots of carpeting in the house or things, but all of a sudden, if you have, no traction across your kitchen floor, it's going to be perilous sometimes for your arthritic pet to get across that floor.
Yeah.
And the one I'm going to end with is go for a walk. Okay? Every day, make sure you go take your dog or even your cat, if you can safely do it, go outside. Yeah. Go outside and walk. Any walk is better than no walk at all. Yeah. And if your older arthritic dog can't do, I aim for about 45 minutes of walking per day for all of my patients. That's what I aim for the dogs. But it doesn't have to be all at once. So if you can get out 3, if you work from home, get up every hour or 2 when you're up and about throughout the day and take your dog for a 2-minute walk. If they're really old, they can't do a lot. But get out and keep the body moving. Perfect. That'll be a big help.
Just a very quick one. Lynn, help us with this one. Double-coated breeds. Fill us in afterwards about things that we potentially could do. I've never owned Huskies and Malamutes, so I don't know about their coat types, so please do add. Do we suggest elevating the bowl for large dogs? Yes, we do. There's 2 papers about this. The one that had 1,000 dogs in it showed that there was no increased risk of bloat, but the one that had, I think, less than 100 dogs in it showed an increased risk of bloat. So what we suggest to people do, if you are going to do raised bowl feeding, it's shoulder level high. Try and use maybe a slow feeder. feed small quantities, water can always be raised. We haven't read anything to say otherwise regarding that. But I love scatter feeding. I really like the hide and seek element. I like the idea of improving quality of life and getting them moving. So my number 10 is actually not about the dog, it's about the owner. One of the things that CAM aims to do is be a support network for owners, because doing my one-on-one home service, I realized that there's a lot of people out there, they might be in busy households, they might have a loving husband and great children, but they feel very, very alone in managing their dog's disease. I can remember, I love my dad, but I screamed at him one day when Holly slipped on some steps trying to get into the house, and why he hadn't been there to support her. You know, he's 78. You know, of course he wasn't going to be there, but I felt I really wanted to be doing the best for my dog. And I know that there's a lot of people out there that feel quite alone in managing their dog's condition. So share it. We've got Holly's Army, which is a community group that will listen to you, because there's so many people in the same boat there. Come onto the page whenever you can do. Your vet practice will be trying to set up OA clinics. They want people to support these ventures, so go and join it. Speak to your nurses, the receptionists play a role as well. So don't lock it inside. You know, there are many people that are in the same situation as you. Matt, you're amazing. You're so easy to talk to.
It's been fun.
You're so down to earth, which is awesome. Would you do it again?
Absolutely. Had a great time.
Yes. People are still talking about food. I'm just going to say that there's 101 ways to do this.
Yeah.
Manage weight is the most important thing. Let's remember that everybody loves their dog, and your choice of feeding is very personal to you. Please be kind to each other. Alrighty? Thanks, Matt. Until next time.
Cheers. Bye, guys.